As we move ahead with our fourth plenary session, this session presents another opportunity to gain deep insights into the topic Innovative Training and Education for Midwives. We are privileged to have with us Dr. Anjalaji ma'am as the chairperson for this session. I cordially invite you on the stage, ma'am. So Professor Dr. Anjalaji ma'am, she currently serves as Professor Vice Principal cum Nursing Superintendent at Era College of Nursing, Lucknow. Ma'am has a PhD in Nursing from RKDF College of Nursing, Bhopal. She holds an MSc Nursing, Community Health Nursing from KTG College of Nursing, Bangalore under RGUHS. An MDM from Indian Cell Therapy Institute, Madurai. PGDHM from Board of Academic and Executive Council, Chennai. And MA in Sociology from Swami Vivekanand Shubhurti University, made at Noida, and a BSc Nursing from KMCH College of Nursing. The ma'am has over 2 decades of experience in nursing education and administration, starting as a lecturer cum clinical instructor at Narayana College of Nursing, Vellore, followed by a ward in charge in EMR casualty at AVMCH, Puducherry. Later, she served as a lecturer at KTG College of Nursing, Bangalore, Eras College of Nursing, Lucknow, Assistant Professor, Associate Professor, Nursing Superintendent at ELMCH, Era University, and Vice Principal since 2017 and Professor. Ma'am has actively participated in over 30 national and international conferences, workshops, and seminars, including serving as a resource person, moderator, and co-scientific secretary for various nursing and healthcare-related events. Ma'am have guided and published multiple research studies in national and international journals covering topics such as kangaroo mother care, basic life support, essential newborn care, insulin administration, fertility factors, and Pradhan Mantri Jan Arogya Yojana utilization. Ma'am has organized college programs, workshops, staff development programs, and participated in community health initiatives like pulse polio, immunization, AIDS awareness, and STD camps, and have a strong foundation in statistics and research. Ma'am holds lifetime membership in various professional bodies including UIJIR, CNRS, International Researcher, NSS, INSC, GLP, and AHA per Era University, Lucknow. Ma'am has excelled in healthcare, education, leadership, research, and social impact, earning prestigious awards like the Astor Global Nursing Award, Best Teaching Award, Indian Women Leadership Award, Prestigious Scientist Award, and Bharat Gaurav Samman. Her contributions have gained national and international recognitions, including the Icon of Asia Award and Universal Hall of Fame record, showcasing their outstanding impact across multiple fields. Ma'am has also made significant contributions to nursing, healthcare, and education through multiple published books, research papers, and book chapters. Her notable works include Role and Responsibilities of HCP, Community Procedure Book, Manual Record for PBBSC, and Current Trends in Infection Control Safety and Prevention. Several chapters have been published in academic books on nursing education, infection control, communication and management, microbiology, and nursing informatics. Publications span national and international platforms with ISBN, ISSN registrations from reputable publishers. Additionally, multiple works are under process, covering topics like nutrition, emergency drugs, hospital services, and healthcare instruments, further strengthening her academic and research portfolio. To join Ma'am, I would like our distinguished speaker, Ms. Karen Drayton Ma'am, to kindly join us on this stage. Oh, okay. So Ma'am is already here on the stage. Sorry, I didn't notice. I would like Mrs. Pragya Singh Ma'am to kindly come up this stage and formally welcome both our chairperson and speaker of this session. Now I would like Dr. Anjalachi ma'am to formally introduce our speaker ma'am.
Happy afternoon to all. How are you all? Are you happy for today? Because we had a lot of expert, because even we can try, we won't get this type of lecture from anywhere. So what instead only we can expose always for 3 year, 4 year like that. So it's a good chance. You all proud to be today, and you had a lucky principal, and she was coordinated with everyone. She was carried out the nice conference. At the same time, you got the opportunity to meet various of leading hospitals and head and principal, everything. You will be created for your future opportunity too. So thanks to Dr. Deepthi ma'am for giving and arranging this opportunity. Happy morning to all the dignitaries on the dais and audience. It's a very proud to be present today as a chairperson here, and we need to be speak about the midwifery. So what is any idea for midwifery? Already from morning we saw. What is midwife? So mid means what is the middle? What is wife? Already if in every human life, wife means it's throughout. Everybody commonly think it's take care of the family. It's right? If any girls started for marry, immediately the mother-in-law, father-in-law, everybody said, I can hand it over all the responsibility to her. So that means it's a wife. So midwife means middle of the life journey. Everyone took the birth and death, but the middle of the journey we are cross, lot of changes, lot of task and lot of responsibility to lead for your life. So based on that, from morning we saw already how we can lead for the midwifery, that is the education policy training standard. What are the skills we can apply on this, we saw. Now we can see Mrs. Korean ma'am, how she will be teach innovative based on this to lead for our career. So now I am going to welcome for our Miss Korean ma'am has been nurse and midwife in the UK since 1999. She holds advanced diploma in nursing and BSc Honours in midwifery studies, working in 4 different hospitals in England, and she also provides period of emergency obstetric nurse training, work in 3 countries, Bangladesh, Kenya and South Africa. Between May 22 and December 23, she worked in Jabago in Wardha and Maharashtra, Jabalpur, Madhya Pradesh in the government of India program associated. She has become the nurse practitioner and midwife educator trainer as an international midwife educator. She is currently working for CEL Community Empowerment Lab on research implementation on maternal and newborn care in Lucknow, Varanasi, UP. So first we can be proud for human being, because how many natures are there, creatures are there, any idea? Any idea? Creatures. There are more than 18,000 creatures are there in the earth. Out of this, we have the lucky of human. So we should be proud. In this, we have only 6 senses. Remaining or having 5 only. But they will be, every person took birth and death. But we have the special to have something in the society, to create something, to take care of your responsibility. As that, Mrs. Korean ma'am took responsibility to change the developing country of India. So we all together put the hands to welcome her dedicated service in midwifery and training sessions. Welcome you, ma'am.
Thank you so much for your welcome. My name is Karen and I come from the UK, but I am very lucky to be working in India now, because everyone in India, they are so welcoming. So everybody is always looking out for me. Are you okay? Can you wear a sari okay? You need this food, you need some drink. Everybody looks after me. So thank you for your welcome in India. I have been here nearly 3 years now, and I have learned a lot about childbirth in India. So this is what we are going to be looking at. But first of all, I would like to know something about you all. So if you are a first year nurse, can you put up your hand? First years, any first years here? No? Second years? I'm also testing whether you understand my English, actually. Second years are over there, well done. Any third years? Lovely. And you have fourth years also? MSc? Lovely. So, welcome to this conference, and thank you for welcoming me. I have one more question. Well, I have lots of questions. If you know only one language, you can put up your hand. One language, you can put up your hand. So this is only me. Anybody knows 2 languages? 3? 4? 5? Indians are amazing. You know so many languages and you can communicate so well. What I would like to know next is, would anybody like to share with me, why did you become a nurse? Why did you become a nurse? So, I'm sure you have many stories. My mother was a nurse and a midwife, so for many years I did not want to be a nurse. I did everything else except being a nurse. But then I thought, let me try and be a nurse. And since then, I was very happy. So in this photo, am I looking excited? I look excited? This is because I'm a midwife, because I get to see so many babies. I get to see so many women who are so happy because they had a baby. I get to be with a woman while she's having a baby, and I can see the joy on her face. And it's a very special time of your life when a new life comes into the world. So I'm very privileged to be a midwife. So this is one of the babies that was born with me. So what do you think the baby is feeling? What do you think it's thinking? And will it grow and thrive? So this baby has just been born, but in India, the statistics for baby deaths are very high. In UP especially, the neonatal mortality rate is 36 per 1,000. 36 babies out of every 1,000 die, either stillbirths or neonatal deaths. Of these 36 babies, 39% die of birth asphyxia. So for me, this means the birth process is not good. Why is the baby being asphyxiated before it even starts life? This is not normal. So while I've been working with the Community Empowerment Lab, we have been looking at all the reasons why babies die. Why do they die in labor, after labor, and within the first month after birth? So while we are thinking about what the baby is thinking, we'll just watch a video, and if you like to close your eyes and listen, and we can feel what the baby is thinking. I have to press?
आप सभी को मेरा नमस्कार। खासकर हम कभी बहुत ही मुश्किल में हों या बहुत बीमार हों, तो हमारे मुंह से सबसे पहला जो शब्द निकलता है वो है माँ। और अब हम एक नवजात शिशु के लिए उसकी माँ क्या है ये जानने के लिए हम खुद अब अपनी माँ के गर्भ में प्रवेश करेंगे। तो आप ये सोचने की कोशिश करें कि आप सब आप अपनी माँ के गर्भ में वापस आ चुके हैं। आप अपनी माँ के गर्भ में हैं, बहुत ही सुरक्षित और सहज महसूस कर रहे हैं। आप पहले एक कोशिका थे, केवल एक ही कोशिका, और अब 8 महीने हो चुके हैं और आपका शरीर देखते ही देखते एक कोशिका से कई करोड़ों कोशिकाओं में बदल चुका है और उसने एक नया रूप ले लिया है। और ये पूरी प्रक्रिया, एक कोशिका से लेकर एक जीव तक की प्रक्रिया, ये सब आपके माँ के गर्भ में ही आपके साथ हो रही थी। आप और कुछ दुनिया के बारे में नहीं जानते हैं, केवल आप अपनी माँ, उसके दिल की धड़कन और उसके गर्भ को ही जानते हैं और उन्हें ही महसूस करते हुए आपने जीवन के अभी तक के क्षण गुजारे हैं। और आपके जीवन में, आपके शरीर में इतने बदलाव आए, एक कोशिका से लेकर एक जीव बनने तक बहुत से अनगिनत बदलाव आपके शरीर में आए। और इन सभी बदलावों के लिए आपको खुद से कुछ भी नहीं करना पड़ा, कुछ भी आपको यत्न नहीं करना पड़ा, कोई भी आपको परेशानी नहीं हुई। ये सब अपने आप आपके माँ के गर्भ में आपके साथ हो रहा था। आपको कुछ भी परेशानी, कुछ भी दिक्कत महसूस नहीं हुई। एकदम सहज रूप से ये सारे बदलाव आप में आ रहे थे और अब आप अपना रूप लेते चले जा रहे हैं। आपकी माँ आपके लिए केवल माँ नहीं है, आप तो शायद माँ का अर्थ भी नहीं जानते अभी तक, लेकिन आप ये जानते हैं कि आपको किसने रचा है, आपको किसने बनाया है। आप इस पूरे समय उसी गर्भ में थे और इसलिए आप माँ को ईश्वर के रूप में ही देखते हैं, क्योंकि उन्हीं ने आपको बनाया है। माँ के गर्भ में बहुत मीठी सी गर्माहट महसूस हो रही है। बहुत ही अच्छा लग रहा है आपको आपके जीवन के लिए गर्माहट की बहुत आवश्यकता है, लेकिन माँ के गर्भ में उसके लिए आपको कुछ भी यत्न करने की जरूरत नहीं है। माँ का गर्भ ही आपको गर्म रख रहा है। आपको जीवन के लिए ऑक्सीजन की भी बहुत ज्यादा आवश्यकता है, उसके बिना आप एक पल भी नहीं जी सकते, लेकिन उसके लिए भी आपको कुछ भी यत्न करने की जरूरत नहीं है। और इतनी चुनौतियां आपके सामने अब आ गई हैं कि सबसे पहली चीज जो आपके मुंह से निकलती है वो है रोना। आप रोते हैं क्योंकि इतनी मुश्किलों में आप आ गए हैं और इतने अच्छे, इतने स्वर्ग जैसी जगह से, गर्भ से, जहाँ पे आप बहुत ही सहज रूप से, बहुत ही कंफर्टेबल थे, वहां से आप एक बहुत ही चुनौतीपूर्ण जीवन में अब आपका प्रवेश हो गया है। और अब जो गर्भ के अंदर की जितनी भी सुरक्षा थी वो कुछ भी आपको उपलब्ध नहीं है। आप कीटाणुओं से घिरे हुए हैं जो आपका जीवन लेने के लिए एकदम तत्पर हैं और आपसे लड़ने के लिए तैयार हैं, लेकिन आपके पास उनसे लड़ने के लिए एक भी शस्त्र नहीं है। ऐसी चुनौतीपूर्ण दुनिया में आपका जन्म हो गया है। अब आप धीरे धीरे अपनी आंखें खोलें। तो शिशु के लिए उसकी माँ, उसकी ईश्वर है और उससे जन्म के समय उस ईश्वर से वो बिछड़ जाता है और बहुत ही परेशानी वाली, बहुत ही चुनौतीपूर्ण एक दुनिया में उसका प्रवेश होता है, और बिना जब हम उसे अपनी माँ से अलग कर देते हैं तो हम उस ईश्वर का सहारा हम उससे ले लेते हैं। और केएमसी क्या है? केएमसी के बारे में हमने बहुत सारे अपने विचार व्यक्त किए, लेकिन केएमसी उस माँ रूपी ईश्वर से दोबारा जुड़ने का शिशु के लिए एक तरीका है, और इससे वो सारी मौलिक जो उसकी जरूरतें हैं शिशु की, वो सारी चीजें हम उस तक वापस ला सकते हैं। वही गर्भ की सुरक्षा,
So now we know what the baby feels. The baby wants some oxygen. The baby needs some nutrition. The baby needs warmth. And the baby needs some love. So all these things we want to give to every newborn baby. But will this baby survive the next 28 days? There are so many reasons why it won't survive. So we've been looking at all the reasons how we can improve neonatal outcomes. So first of all, antenatally, we need to look after the mother. Too often I have heard that the mother-in-law is not feeding the daughter-in-law. The mother is the last person in the family to get any food. Her diet is less than anybody's, and yet she needs more protein. She needs iron, she needs immunizations against tetanus, and she needs calcium. She needs to be stress-free, not worrying about anything. We need her to register the pregnancy early. Then we can see, has she got any high risk factors? Should we be referring her to the doctor? Should we be giving her extra blood pressure checks? Should we be checking her for sepsis? She also needs to be aware of the danger signs, and not only her community and her family. Too often people are so delayed when they come to the health facility. Oh, I was having some bleeding, but I thought maybe it will stop. Oh, my head was banging with a headache, and my eyes had lots of visual disturbances, but still I didn't want to bother anybody. So we need to encourage women and their families to know what are the danger signs and when they should come to the hospital. Then we can treat them, and then the baby will have a better chance of survival. They also need to be aware of the benefits. The government has provided many benefits to try and improve maternity and child health. Some people in the very rural areas, they do not know what these are. So if we do not communicate, they will not hear about these. They will not take advantage, and they will become even poorer. Birth preparedness. I'm sure you all have lots of lectures on all these things. Birth preparedness is being aware that you need some transport. You might need some extra money to get somewhere. You might go to one health facility, they might want to refer you to the next one. You need to be mentally prepared. You need to be physically prepared to bring some clean cloths in. Where I work in CHC Cholapur in Varanasi district, the mothers, they bring in dirty cloths. For a brand new baby, this baby will get sepsis unless they bring in beautiful, soft, clean clothes. So these, you know all about these, the Government of India initiatives that have been going on to try and include everybody in the programs for health. So at the bottom you can see the guidelines of midwifery services. So Dr. Monica was speaking all about this from Jopaigo's point of view, and I was working with Jopaigo for this program for 2 years. So I think in India and around the world, we treat a pregnant woman like a robot. We don't see her as individual. We don't give her empathy like she needs. We don't look at her history. Her history will be different. Every single person will have different history, different concerns. And we need to listen and find out what is that history in order to be able to provide good care. So if we look at physiology rather than looking at the person like a machine, then we will be able to do birth better. But there are so many reasons in India why people find it impossible to do physiological birth. The evidence shows that up to 90% of labours are induced with oxytocin or misoprostol. And I have seen it myself. I've been to at least 15, 20 hospitals. No one will admit to it, but it is happening. You will all learn oxytocin is bad before delivery, but everyone is doing it. So this morning, I want to encourage you to do what is right. Even though it will be a problem for you, you need to stand up for what is right and what is good for the woman. So labour needs time and space and respectful maternity care. Dilatation takes time. Yes, everybody's in a hurry. The patient wants to hurry up. They don't want that pain for so long. The mother's family doesn't want it. The community doesn't want it. The doctors don't want it. And the nurses, everybody wants to speed up the labour. But if you do this, the baby gets asphyxiated because oxytocin makes the uterus contract more. So as the uterus is contracting, the baby gets squashed and there's no oxygen going to the baby. So in a normal labour, there's a squashing and then there's relaxed. Squash, relax. If you do it too fast, the poor baby never gets a chance to breathe inside. The oxygen is not getting to the baby. So this is why we get 39% asphyxiated babies. Because the oxytocin is making the uterus contract too often and it's not allowing the baby to recover in between contractions. So this is really bad unless we regulate it, unless we are trying to induce somebody gently. We have to monitor the fetal heart. How is the baby coping with the oxytocin? If it's not coping, we have to go for cesarean. So descent also needs time. Stretching needs time. How often do you see somebody going like this, trying to get the baby out? It doesn't help. And all it is very painful for the woman. And I never saw anybody do restitution. You all know the process of birth. How the baby comes down, it turns like this, comes out beautifully. But as soon as the head is out, people yank the baby out. And before they're yanking out, they're giving fundal pressure. And before fundal pressure, they say, oh, she is 8 centimeters dilated. Jor lagao, push the baby out. And then everybody's shouting, push, push, and this poor baby is, what's happening? And the fundal pressure is also terrible. So all these things we're doing just to hurry up the labor, when actually the woman has been pregnant for 9 months. So why should she deliver in 9 minutes? We need some time, right? For the baby to adjust from inside to outside. And then we need skin-to-skin time, 1 hour at least. Skin-to-skin helps breastfeeding. In UP, the breastfeeding rates within 1 hour is 24%. Only 24% of babies get breastfeeding within 1 hour. This is terrible, and this adds to the deaths. If the babies are not fed early, they will die soon. And also, we found in the rural sub-centers, they want to go home immediately. They should stay for 24 hours to rest, to see if there will be a PPH. We can give them lots of advice about what is good to do postnatally. But no, they love to go home and have their own problems without help. So, I have a program called Beautiful Births in Varanasi. We are trying to promote beautiful births. They are gentle, they are physiological, and mothers are happy and the babies are happy. So we don't do any routine interventions. No inductions unless necessary. No routine episiotomies. Because if you wait, the body stretches up. We don't need to cut the woman. Even for primies, it will stretch if we give it time, if we are not doing fundal pressure. We don't need to do episiotomies. In my life, in 20 years in the UK, I have done about 6 episiotomies. And I work in labor room all the time. So we don't need to do them all the time. And where I work in Varanasi, the nurses there have seen, wow, we don't need to do episiotomies. And it's quicker because now we don't need to suture. So this is one thing we can try and do. We should only do vaginal examinations every 4 hours. I was in one medical college. A woman was there. The doctors came in. 4 doctors in 5 minutes did a PV. Not one had consent. Nobody explained to the woman. And they just did the VE and they didn't communicate between themselves. Is this a good thing for the woman? It's terrible, isn't it, right? So we need to stick up for that woman. We need to support her human rights also. And we can always point to evidence-based care, 4 hourly. Obviously, if you're trying to teach, then teach somebody properly. Ask the woman, then do it, and then say, what can you feel? And learn from it. So they don't all have to go like this. All inserting their fingers and making infection. We can use a partograph to see if it's taking too long. We can encourage mobilization in labor, upright positions for birth, and non-pharmacological means of pain relief. So this woman, this was the Jupaigo program that we heard about last session. These are the 2 NPMAs, nurse practitioner, midwife, educators. The woman is upright. It's her first baby. She's sitting on a birthing stool. She has 2 birth companions, and we are having fun. You think we can have fun in labor? We can have fun. It is good. We can chat about their family, what is happening, and the whole experience can be beautiful. So the impact of physiological birth. For me, the best impact, the mother is smiling. She gave birth. She had so much pain, but as soon as that baby's born, she will say, oh, it's not that bad. That pain was bad, but now I can forget it, and the baby is beautiful. So the recovery is quicker, much better than cesarean. There's less blood loss, early breastfeeding, and maternal bonding, and self-esteem. All psychological things make the woman feel better. So what about this baby? This baby is distressed and not happy. So this is a lady. We are trying upright positions, even within the current system of labor rooms. So we can say, oh, there's no room to do upright positions. But we can monitor the baby's heartbeat, and this woman is very comfortable in squatting position. She's actually smiling, and 5 minutes later, she gave birth. Even I was amazed how fast just sitting her up did. She was so happy. So physiological birth makes use of hormones in labor. So if you see the medical textbooks, they're this thick, right? A medical book is so fat. So I'm looking for normal birth. It is 3 pages. And yet, normal birth can be, it doesn't have to be all pathological. This is the important part, is just the 3 sheets. And yet we just think it's all about medical problems and pathology and what can be wrong with a woman. Why don't we think maybe everything is okay? So there are lots of hormones in labor: oxytocin, beta endorphins, relaxin, melatonin, prolactin. You know all about these. We know what oxytocin does. Let me use this one. Hello? Is it okay? So we can use oxytocin enhancers. So what makes oxytocin flow better is if everybody is calm and confident, no smoking, no shouting and going on. If there are positive expectations, the woman is feeling safe. Say, it's okay, you're having pain, but it's normal. We'll be with you, we will support you. So this is what midwives do. We can give massage, we can give warm water compresses, we can laugh with them, and then they forget they're in so much pain. These are just simple things. But nowadays, we love high technology and the support of birth companions and everything. I lost my thing. So beta endorphins, they also help the woman feel less discomfort and pain. Relaxin helps you to relax. Melatonin also comes if we leave the woman alone, if we don't stress her out. Prolactin is connected to breastfeeding, increases during pregnancy, increases breast milk production, and ejection of breast milk when the baby starts sucking. So all those things help the baby to feed well and to become a successfully healthy baby. Whereas the hormones and chemicals that slow down birthing are adrenaline. You know, when you're stressed, your adrenaline levels go up. When there's lots of noise and you don't know what's going on and nobody's talking to you and everybody's shouting at you, this is when you get stressed, and this blocks the oxytocin and the endorphins and the relaxin. And catecholamines, they also increase stress. So physiologically, all these things are going on in your body. As nurses and midwives, we need to work with that woman, not against the woman. So therefore, we have a duty to provide that kind of environment. We can't keep saying all the excuses, oh, we don't have time, we don't have room. Who decides how much room a birthing woman needs? We can say, let's change things a bit. So in our Beautiful Births program, we try and advocate for evidence-based practices. And then when the baby's born, we try and keep them skin to skin for all the advantages of that. And we try and avoid oxytocin and misoprostol. We never do fundal pressure. This can cause so many problems to the mother. Why I took this picture was, above every birthing woman, there is a poster. It says no fundal pressure. But I have seen so many people do fundal pressure like CPR. They sit on the woman's head and they give fundal pressure. Whatever is on the walls is not what they are doing. And then this baby might have shoulder dystocia, nerve damage, and it will be stressed in addition to the oxytocin stress. Episiotomy by the World Health Organization is not recommended. There are only a few cases when we should do episiotomies. If it's complicated vaginal birth, such as breech, shoulder dystocia, if you're using forceps or vacuum, then we can do episiotomy. Or fetal distress. But people do episiotomies for no reason, because they haven't been monitoring the baby's heartbeat. So how do they know if the baby is stressed? So we need to do fetal heart rates. Is the baby distressed? And then we can deliver the baby. So this is the normal position of a woman when the baby is coming out. But why don't we do her upright? The baby's coming out this way, but how much more easy if the baby is trying to come when the woman is upright, squatting, or some other position. So we can try all these different positions. It doesn't take a lot of effort. Just ask them to stand rather than to lie on the bed, lithotomy position. These are in Jabalpur in our labor room. You can see how close together the beds are, and yet we're still getting a chance to massage and to reassure the woman. We can use birth companions, and we can ask them to do exercises. So upright positions can reduce pain in labor and shorten labor times. And we can use lots of different positions. These two photos I showed you before, this is the birthing stool that we use. So people can support her from behind and give massage, and the midwives need to get in a different position to catch the baby. We can do semi-sitting, all fours, squatting, or sitting on a support. So these show the baby descending and rotating. Can you see the baby has turned? Turned a bit more. And now it's coming out. Coming out. Coming out. And then it turns to the side. So all babies need this restitution. No pulling the baby out. And then the baby comes out much more gently and less stressed. So for newborn care, immediate skin to skin, unhurried care, no maternal baby separation for 1 hour, and initiate breastfeeding immediately. And talk to the woman about everything about babies. New mothers, they don't know anything except what other people tell them. And as a health professional, you can tell them all the good things. Delayed cord clamping improves newborn hemoglobin levels. If we do immediate cord clamping, the baby is losing up to 1/3 of its blood supply. Let the blood go to the baby a bit more while it is adjusting to becoming breathing in the air. Breastfeeding in the first golden hour. If you don't feed in the first hour, the risk of that baby's death is 1.3 times. So it's much more likely to die if you haven't breastfed it within 1 day. And it's amazing how these babies are not fed. You ask them, when did you last feed the baby? And they'll say, oh, I don't know, yesterday? And you think, but the baby was just born. It needs feeding every 3 to 4 hours. And respectful maternity care. I'm sure you know lots about this, that we need to look after the woman's rights, and the woman's position, the woman's right to have a companion, and respect for where she comes from. So the Jupaigo talk talked about, why does India need midwives? Because we have over 30 million pregnancies a year, and we don't have enough staff. So we need to have more people just invested in midwifery and childcare. And 80% of preventable maternal deaths, stillbirths, and neonatal deaths can be prevented. 86% can be prevented just by nurses doing midwifery care, being trained in midwifery practices, and doing physiological births. So in India, the maternal mortality rate is 97, but within every state it's very different. So UP, it was 130. Neonatal mortality rate is 32 in UP, and I told you already about breastfeeding rates. So there's so many reasons. So my topic today was innovation in midwifery education. So this slide shows different methods of training midwives. So this one is nurse training. We go to college, then we go to the hospital, college, hospital, college, hospital. And this is how we learn, isn't it? We learn by in college, we learn the theory, and then we go to the hospital and learn practicals. And then when we finished, we go to all the different hospitals. Sometimes we go to the hospital again. So in the Jupaigo project, they decided that people need ongoing training. So it's not just one-off. You learned everything you needed in college. You need to keep learning. So after this, if you go to the Jupaigo or any other Government of India midwifery project, you have 3 weeks of college, and then you spend a lot of time in the hospital practicing doing physiological birth. Because women don't have the confidence to do births without oxytocin, without fundal pressure, without episiotomy. So we need to have confidence, and that's what this program does. Did I do it wrong? So then now I was working for Jupaigo for this program. Now I'm working for the Community Empowerment Lab. So this model is everybody is already in the hospitals. So one person goes to CHC and says, let's do something different. Let's make beautiful births. And we do one thing at a time. We say, let's not do oxytocin. Let's not do fundal pressure. Let's not do episiotomy. And then now the staff there, they are all happy to do beautiful births. Nobody does episiotomies unless there's a big need for it. Nobody does fundal pressure. We also send a community team to tell the community, don't ask for oxytocin, don't ask for fundal pressure. We will do nice, beautiful births in Cholapur. So people are coming from different districts just come for a beautiful birth. Because women want to be treated nicely. They want to have a good birth. So this is the model that we're using at the moment, where we go from one to the next one. And then somebody from this one, maybe the A&Ms or the staff nurses, they will go here, and they also will share all the knowledge. And because in India there are so many health facilities, we need to spread the message about beautiful births as much as we can. So this is our innovative way of education, using nurses, additional training, and then going into the places where women are actually giving birth. So I'm coming to the end of my talk now. What do these women have in common? Do you know who these women are? Rani Lakshmibai, the middle one, is Princess Chandni, apparently. And this one on the right, Rani Durgavati, actually. So from Madhya Pradesh. But having been in so many states in India, every state has these wonderful people, right? So they are freedom fighters, and they are strong people just like you. They know what is right, and they want to do it. So this is what I would like to encourage you today to do is, we know what is right for beautiful births. We know women have a right to a beautiful process to welcome their baby into the world. So we are all part of this. So I'm encouraging you to be freedom fighters. So this is one of our NPMEs. And she is also an inspiration. For 18 years, she delivered so many babies, even up to 20 babies in a day. And she came on our program in Wardam, Maharashtra, and she helped a woman give birth in a beautiful manner. And the woman said thank you to her. And she said, I have been a nurse for 18 years, and not one person has said thank you to me. And she cried, because it's the first time she felt satisfaction with her job, because she had been one of these shouting women and pushing women and demanding women and disrespectful women. But learning how to be a special person, she has changed, and she is so satisfied. So let's make it possible. Service with a smile. Doesn't want to go. So thank you, that's it. I don't know why it's not going.
Thank you, ma'am, for this beautiful session on beautiful birth. I would like Dr. Anjalaji, ma'am, to kindly provide feedback.
Welcome back. I think all are enjoyed this session. I enjoyed a lot because madam was bringing out 99 to 2000 training period back to me. Because we were studied that time, we had for the semester system only. We also had 6 months for a midwifery, only one single subject. We was posted in... Then we were posted for various of training center, government hospital. And already ma'am, Binu ma'am said she was exposed for more than 500 delivery. We were exposed more than 2000 delivery, independently we carried out. And we was done all the work. So that's, I thought when I was listening madam name, she will be brought for the UK based stimulation training, she going to be displayed like that. But she come across totally for the lower level, how the person be happy in their life, birth to death. She brought easily. So that every person will always remember, from birth to death, we should remember middle of the level only. The same, the woman also bear their life. So she also have the empower, she must give the choice, she must have the select for the life, she can move everything. When we move like this, she definitely have without any complication for the normal birth. So we cannot give the chance to do like this. So always we will be say, this is a policy, this is a guidelines, you sit like that, you lay down like that, you stand like that, you will deliver like that, you cannot move, you cannot run like that. So all this restriction always goes for the difficulty of the women and in newborns. So based on that only we expose maternal mortality rate, and for the infant mortality rate, this will be increasing. So these preventions we always go as a nicely she was brought it from how ANC care, how the adolescents care, how we can go for ANC, how she was related in the, how the child can feel in the mother's womb, how it will be. Then how, what they listen, who's the exposure person, how badly she was carrying, how she will narrate it to the child. Everything she nicely explained in the video with the silent bass. And she was working in this, all the government associations, wherever the person is not aware, that area as an educator, as a trainer, as a healthcare person, we should make them for more knowledge to get for all the facilities. And she was explained in the physiology way of how the mother can feel, how she can herself deliver, how she can care for mother as well as that, and cord clamming, newborn care, and importance of respectable maternity care. When Rosalie ma'am came for she is a external accessor in our college. Ma'am was asking one MSc faculty, what is respectable maternity care? She can't able to say the answer. You can imagine where we are, the training and education, practice and skill as a MSc level. That means it's always need self-regulations. We as an institution will give the care, as an institution we teach you, training you, practice you. But every individual can realize yourself where you are standing, how you are performing, how much you are going to be work out through your professional dedication. That's very important. Based on that, ma'am was clearly explained where we will be there and how we should be goes. I request all to be there, always be with your skill and practice and knowledge. Right place you can invest and you can utilize. You can don't make any harm to anybody. If already you saw, other than human, most of the animal also giving birth. Anybody saw? Pakri and buffalo and cat, like this you saw, na? Have you anybody is needed for that to deliver the baby? It's simply just for standing only it's giving. But what as a human we are making? We are making lay down, you can push it, you can massage it, you can turn it, you can give like this. So it's a nature also show us nothing to be impossible. In the word itself given is a possible, in impossible itself. That means everything will go for the normal process. As a human, we should be support and empower. We can make them to go lead to happy life. So thank you all. You can everyone, I think, will be practiced based on the madam knowledge. Thank you, Miss Korean ma'am, for giving nice way to narrated everything clearly and simple way. I think ma'am was completed full course with the answer key everything in the slide share. Very important point she was explained. And the skill base she was explained. Thank you, ma'am. Thank you so much.
I request Mrs. Manisha David ma'am to kindly come up the stage and present the memento to our esteemed speaker and chairperson, please.